Now let's look at population statistics. African American women in Los Angeles County face distinguishing factors that negatively affects their health. They are more likely to be a single parent and head of the household with children and face the highest poverty rates. Poor health outcomes amongst African American women are evident with high rates of smoking, obesity, heart disease, cancer, diabetes, and maternal and infant mortality. According to the Los Angeles County Department of Public Health 2017, African American women have the highest unemployment rates and are more likely to be homeless, experience discrimination, and violence. Indeed, these factors serve as significant barriers to attaining optimal health, despite Black women having high rates of health insurance. In Los Angeles County, it was reported that 43% of Black women range from 18 to 39 years old, 39% range from 40 to 64 years old, and 13% were 65 years or older. I was also stunned to read that Latinas are the largest portion of women in LA County. If we look at Figure 1.1 provided by Los Angeles County of Public Health in 2018, African American mothers experience low birth weight delivery 3 times more often than other mothers. Furthermore, 72% of African American women reported as single, and 31% of Black women were single with children. If we look into determinant of health for African American women, such as education, 10% had less than a high school education, 24% received a high school diploma, 44% completed an associate's degree or even went to a trade tech school, 13% had a college degree, and only 7% received a PhD. According to the County of Los Angeles Public Health in 2018, the following percentages were based on African American women who experienced a preterm birth and education completion. It was reported 12% of these women had less than a high school education, 11% had some college education, and 10% received a bachelor degree or higher. The median wages for Black women in the United States is $36,227 per year. That is almost $22,000 less than the median wages for a white non-Hispanic man. The County of Los Angeles reports that 45% of Black women are employed, 16% are unemployed, and 39% are unable to work due to disabilities, being retired, or just unable to work. 4% of these Black women with a recent live birth reported experiencing physical or sexual violence during their pregnancy. 54% live birth who reported experiencing at least one incident of discrimination, and 67% reported receiving social and emotional support. But unlike white women, it was reported 80% received social and emotional support. According to the County of Los Angeles Public Health in 2018, the infant mortality rate for African American babies in Los Angeles County is more than 3 times as likely to die as a white newborn and more than 2.5 times as likely to die as a Latino newborn. The CDC reports in 2016 that 11.4% per thousand live births was due to mortality rates for African American women. According to the U.S. Department of Health and Human Services Office of the Minority of 2019, African American deaths and mortality rated the following top 5 as the leading causes of deaths: low birth weight, congenital malformation, maternal complications, accidents, unintentional injuries, and SIDS. 66.6% of mothers receive prenatal care during their first trimester, and only 10% of mothers received either late or no prenatal care. And it was also reported that 5% smoked during their pregnancy. Now let's dive into some health needs.